I think that's a huge part of any neurological disorder, but especially with CP, because it is visible to other people. A lot of other neurological disorders are sort of invisible, like epilepsy, for example. You would only see it if somebody has a seizure in front of you. But with CP, people see somebody who has a disability, and they then may make an automatic judgment. Or I often say kids can be mean. They don't always mean to be mean, but sometimes they can be. And that can really sometimes impact quality of life more than a motor disability. And so I think that it is really important to have the psychosocial support for, if there's any incidents of bullying, for the school to know about it, for them to have access to mental health care services. A lot of kids also, because of the nature of where their injury might happen, it might impact their frontal lobe. And so they might be a little bit more impulsive, or they might have a tendency to be more anxious. And then if they get anxious, their motor function is not as good. So then we have to say, well, let's also target your anxiety, because you won't be able to be as successful in your therapies if you're so anxious that you don't, you can't participate. So I think that psychosocial component is very, very important.